Hello, my name is Lynda Boyer-Chu, and I'm a faculty member at the University of San Francisco. I have been a nurse for over 40 years, and my specialties are maternal child health and international health.
My name is Heather Bollinger, and I am an assistant professor with the University of San Francisco. I've been a nurse for 19 years, specializing in emergency and trauma care.
Hello, my name is Dr. Sharon Goldfarb, and I'm a faculty member at University of San Francisco in the nursing department. I've been a nurse for 33 years, and my field of expertise is community health.
Being a nurse means taking compassionate care of the individual and also taking care of the entire community.
Being a nurse, to me, is being an advocate. Being an advocate for your patients and being an advocate for yourself, for your colleagues, and increasingly for the new nurses and students coming into the profession.
Being a nurse means you're in the front lines of healthcare in America today. You have to bring your smartest brain and your most compassionate heart to make sure that every American gets the healthcare they need and deserve.
So the question, if there was one thing I could do to change nursing education to affect the health of Americans, it would be to flip the paradigm. What I mean by that is I would like to see student nurses learn the value of community health. I can give a few stories about my own experience, and I'm going to go way back to when I first started working as a public health nurse in Baltimore. I worked with a family with 3 sets of twins. And after doing my thing of educating her about postnatal care and breastfeeding, it turned out that what she really needed was a change in housing. She said, I need to feed my kids, and the rats are eating all my food. So when I found out that she'd already made many attempts to change housing, I consulted with my supervisor, and she said, go with her. Go to the housing authority. And to make a long story short, she got new housing. Another experience I had was working in Khao Dang, which is the largest refugee camp in Thailand with Cambodian people who are fleeing the situation in their home country. And there at the refugee camp, I was the head nurse of the pediatric ward, and tragically, babies were dying of totally preventable diseases such as tetanus, whooping cough, and measles. We assume that vaccinations are needed, but even now in the United States, we're moving away from that. And nurses need to know the value of vaccinations. Another experience is that right now, I have students in a clinic in the Tenderloin. There, they're doing very basic things, and that includes hand and foot massage. Now, that may seem very basic, but what it does to the people that we're giving care to, it tells them that they still matter. We're seeing them and that we care. These experiences for student nurses are relatively limited, and that's something we need to change. We need to make community experiences in the very first year. We need to bring that forward. We need to de-romanticize hospital care and make it easy for nurses to see the value of taking care of people, not just in hands-on care, but also in situations such as in hospices and in schools and in policy-making decisions. I want nurses to know that there's a direct linkage between our profession and public health. Can we do it? I think we can.
If I had the chance to talk to someone about nursing education, what I would say is that we need better partnerships with our nurses at the bedside, and they need better support to be educators. We know that nursing students learn best in the clinical environment from nurses doing the work, from exposure, from repetition, from experience. That's how we all learn the best. We're challenged increasingly in getting students those opportunities. There's a lot we can do in universities. There's a lot we can recreate, but there's also a ton of opportunities at the bedside where our students could contribute. We need to build those partnerships back up. We need to foster those relationships. We have extremely intelligent, experienced people that are working at the bedside that have been doing this for years, and they have a lot to share. They don't have the time to share it. They don't have the training or the resources in order to provide the type of quality education that the students deserve and that the patients ultimately are going to benefit from. So if we could find a way to increase those experiences, it's only going to serve all of us in the long run. Our nurses at the bedside have more opportunities to share their knowledge. They have more support for the care that they're trying to provide. Our students have more time, they have more exposure, they have more experiential learning, and they will only benefit from that. And our patients ultimately benefit from the fact that new nurses are coming in more prepared for the environment that they're entering, and that the workforce is increasing its competence all the way around. I know that being a clinical instructor and a nursing faculty member makes me a better nurse. It makes me a better nurse because I think about things differently. I think about them more comprehensively. I go to the hospital and I view those experiences at the bedside in a different way because I'm taking something away from it, like how can I share this with my students? How could my students benefit from hearing about this particular situation? So that benefits me as a faculty member. It benefits me as an educator. And I know my students benefit when they have an opportunity to work side by side with nurses at the bedside that, again, have the time to really help them to develop their skills, to help them develop that knowledge. So we really have to focus on fostering those relationships. We have to find a way to provide better resources at the bedside for the nurses that can be great educators, that want to be great educators. And if we can create those opportunities, we're all going to benefit in the long run.
Some of my students ask me what are some of the biggest challenges they'll face when they graduate. And I often think of a patient I had that I think exemplifies some of the big issues we're having in healthcare today. I was working in a free clinic in Oakland, and I had a patient come in who was a Vietnam vet who had served 3 tours of duty. At the end of his 3rd tour, he had so much sadness, depression, post-traumatic stress that he started using heroin. He was dishonorably discharged from the military, and therefore he could not use his vet benefits or go to the VA hospital for care. He came to me at a free clinic because he suffered from psoriatic arthritis, which is an extremely painful kind of arthritis, maybe the most painful arthritis. And it's an autoimmune condition. He wanted to have some pain management and some medication to deal with that. And we tried what we had in the clinic, a lot of over-the-counter medicines given at prescription strength, but it really didn't hold him. So we knew we had to put him on a very strong medication. When I got him the prescription, he said to me, "Sharon, this is too expensive for me. I'm on a fixed income and I'm going to have to choose between food and medicine." And I said, "No, I can help you with this." And I began the labor-intensive process of signing him up for Meals on Wheels so he could have some free meals delivered to him, and doing a very lengthy patient assistance program through the pharmaceutical company so he could get his medicine at cost. As we were preparing for him, once the medicine came and we got all our ducks in an order, I did one more exam and I saw that he had terrible, terrible dental decay. He had missing teeth and rotten teeth, and I realized I couldn't put him on his medicine, which was an immune suppressant, because his dental infection would get very bad and could lead to septicemia or even an infection in his brain. And so then I went through the process of trying to find a dentist who would see him pro bono and help him with his dental decay so he could go on this medicine. Right now, when we teach nursing students about what they need to know as a nurse, we stick to textbooks, which really talk about diseases and nursing interventions, and we don't talk about the complexities of our healthcare system today, which is really showing that patients are having more serious medical problems, more serious polypharmacy issues, more serious life expectancy rates, and huge problems with healthcare equity, making sure that everyone gets the healthcare they need, no matter their zip code or their income or their race. And students really go into the field knowing they want to be caretakers and they want to help people. And they're confronted by a very complex system, a system that is focused on making money, a system that really wants people to document for profit as opposed to getting patients exactly what they need. We often discharge patients with prescriptions they cannot fill, with resources not in place for their complex medical problems. And this really hurts nurses. We're compassionate caregivers, and what ends up happening is a lot of moral outrage, which results in nurses leaving the field. And the huge attrition rate is a big problem. So I believe the answer is in education. We need resources so we can really teach students about the complexities and make them leaders and change agents to help fix a broken system and give patients the best care that they can get, no matter who they are or where they live. And nurses can do it if we educate them to do it.